So now we will go into some of the symptoms so that everyone knows what exactly symptoms, and then we will try to also relate these symptoms to which particular dosha. That tells us that which dosha is increasing. Now if it is increasing does not mean we cannot do anything. This is the beauty of this particular knowledge, that whatever we see is naturally increasing or it is increasing due to we are doing wrong things, we can actually reduce them or stop them from coming. So that's the beauty. So I will go through the list of the symptoms. This is particularly in the perimenopause, so just before, you can say few months. So which means that at this stage women would see, oh, missed one period, or sometimes no period for 3 months and then period came, like that. It's that kind of phase. Okay. So in this irregular periods, that's what and because we saw in that diagram which was showing the graph how everything was jumbled up. So when it is showing up, then the hormones goes up, and then the periods may come, and then again they go down. So then period may not be there for 2 or 3 months, or maybe even longer. So irregular periods, and that is the irregularity is the symptom of increased vata.
Okay. More air.
More air. Yeah. And then second is the vaginal dryness. So dryness, that's again air. So the dryness increases because the lubrication or hydrating ability is going down. So kapha is going down, or water element is going down. So that's why this dryness comes, and that is again vata, or we can say air, more dryness. Okay. So that's why we are suggesting to drink more good juices, good herbal teas, or water.
Excellent.
Okay. And then we have hot flashes. So hot flashes is really not that you might think, oh, hot flashes, so is it pitta increasing? No, it's the fluctuation period. So sometimes there are hot flashes, that means pitta or fire is increased, so that means hormones are increased, and then they go down, then the hot flashes go away, right? So again,
when there is too much fire, so it's why when we eat spicy meals, then pitta goes up, and we have hot flashes.
Right. So that is that we will talk about that part. That so what exactly we can eat more and what we can avoid more during that time.
Excellent.
So we'll come to that.
Yeah.
Okay. And then night sweats, again sweating is fire, right? So that is also pitta. Okay. Then we have sleep problems. So because of the increased heat, even if we don't have any of these issues, but if it is too hot, we wake up. So when internal heat is increasing, then also that wakes up. So that's why sleep problems. Mood changes, of course, that is also vata. Because of retention of fluid inside, the retention of fluid, there could be weight gain. Okay, and slower metabolism, a thinning of hair. Again, this is also hydration. So if the roots of hair, they have proper lubrication, proper moistening, then the hair will be more thicker and oily. But because vata is increasing, means air is increasing, means dryness is increasing, because the oiliness is reducing. So that's why hair starts getting thinning, and sometimes even hair fall starts.
It's like a flower.
Right.
We need.
Right.
Yeah.
Exactly. Okay. And so dry skin also. So the oiliness, the people start complaining. Now they have more dry skin, loss of breast fullness, again vata. So what are the treatments that actually modern medicine recommends? We will go, just for the comparison's sake, we will go through very quickly. So this basically, according to modern medicine, doesn't require much treatment, and symptomatic treatment can be done. There is a lot of debate on, sometimes modern medicine recommends hormone replacement therapy. At some point that was considered as very good solution, but now there are debates that there are so many side effects of it. And so that's why should we do it, not do it, and sometimes doctors leave it up to the discretion of women to decide.
And important side effects.
Yes,
like
important.
It's not just
right. Right. So that's why this is now debated, that sometimes the benefits and the negative effects, if the benefits outweigh the negative effects, then it is up to women to decide if they have to go for hormone replacement or not to go for hormone replacement. And then for vaginal estrogen can be given for dryness, low dose of antidepressants if that is. But there are many very good solutions of that depression. One can start the yoga, one can start the pranayam, one can start the yoga nidra, one can start the meditation. So non-drug therapies are there that person can do, and good lifestyle and nurturing yourself and emotionally nurturing and be with the friends who are understanding and who are nurturing, you can take care of these things.
And finding a purpose as well.
Yes.
For depression.
Exactly, yeah. And then GABA Pantene is also given for hot flashes, medications for osteoporosis. So these are some of the treatments that are recommended. Some of the modern lifestyle approaches, particularly during this phase when the perimenopause or menopause phase, so cool off because heat particularly is fluctuating, so generally cool off. Okay, and avoid spicy food, of course, because as we see, when the hot flashes are coming, spicy food will increase even more.
Yeah, so that's more on the Ayurvedic
approach. Caffeine, because caffeine and alcohol is acidic, so increases heat, so that is also, and caffeine increases dryness, and dryness is already increasing in the body, so that's why. Okay.
Yeah.
And then decreasing the vaginal discomfort, there are creams, get enough sleep, make a proper schedule to go to bed in time. Relaxation techniques, we talked about those, pelvic floor exercises, balanced diet, avoid smoking, and do regular exercise.
Can you talk a little bit about the smoking? Because some women smokes at that age, and what's the impact of smoking?
The thing is that usually why, it's basically there is this discomfortable emotional imbalance in the woman, and in order to not face that situation, to engage in something, and that could be even harmful, but it is engaging in something outside, so they get out of that zone of not feeling good. But the negative effects of smoking we all know. Basically, if the lungs are healthy and throat is and everything is healthy, then still smoking naturally causes injurious damage to the lung tissue.
And on the dryness, let's say on the vaginal dryness, does it have an impact?
It does not have specifically direct impact there, but it certainly does increase vata, which means air, which means dryness, overall dryness. It does increase overall dryness, and that can affect the whole body.